Good afternoon and happy holidays, everyone. Thank you so much for watching this video or for tuning in. I'm just going to put some information about Whitman-Walker services in the caption with a phone number to call if you're looking for that as well. But good afternoon. My name is Ayele, and thank you so much for being here. So again, good afternoon. I'm Ayele. I'm the Community Health Education and Training Coordinator at Whitman-Walker Health. And this afternoon's live is on Mpox. But Mpox, also known as Monkeypox, affects specifically on women and children. During the COVID-19 pandemic, Whitman-Walker's Community Health Department, our department, has expanded its outreach efforts to the social media platform. We cover various topics about HIV, STIs, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. So again, today we're focusing on Mpox and women and children. And I think it's important that we're talking about this today because oftentimes when speaking about various viruses or illnesses, it focuses on certain populations, which increases stigma and misinformation around the topic as well. But we want to make sure that everybody is getting the information that is important to them to keep themselves healthy, but also just to learn about what is going on and its relevance to you. So again, today we're gonna talk about Mpox, but specifically for women, or those who identify as women and children. So, some of the things that were found during this outbreak of Mpox was that women had higher rates of non-sexual transmission. So in males, we saw higher rates of sexual transmission, but for women, there were higher rates of non-sexual transmission of Mpox. Also, we saw different combinations of the signs and symptoms of Mpox. So women presented with anogenital rash less frequently than men, 51% versus 67.3%, but turned up with rashes elsewhere in the body much more frequently. 71% versus 59%. So both of those are significant differences on the way that Mpox presented in those different populations. Also, when it came to women, there were higher complication rates reported than there were for men. A 14.9 risk of complication in women compared to the 8.8% of those cases resulting in complications in men. Women were also diagnosed later than men, which can be explained by several factors. Given the low risk perception present in the general population, women may have been less likely to associate their symptoms with Mpox, thus delaying the consulting and testing. Healthcare practitioners may also introduce gender bias in their clinical suspicion of Mpox, and many have described symptoms in women finding comparable results in the frequency of the general symptoms, such as lymphadeniopathies and oral lesions, but a higher percentage of the anogenital exothemas and any mucosal exothemas. Those words are getting me. But so we see a difference between the way that Mpox has showed up and affected men and women. But one thing to take in mind when reading the statement comparisons as well, they didn't factor in. There was no information or data on whether these were trans women, trans men, or how that was factored into the data. But when it comes to children, in the current monkeypox or Mpox outbreak, reported cases of Mpox in children and adolescents have been quite infrequent, less than 0.3% of the total cases. And the disease is generally not severe when it comes to children. Exposure to a household contact with Mpox is the predominant route of exposure for children, but for adolescents, sexual contact was still the primary route of exposure. Mpox should be considered for children and adolescents that present with a rash that is consistent with the disease, especially if the epidemiologic criteria are present. Young children with eczema and other skin conditions, and children with immunocompromising conditions may be at increased risk of severe disease. And treatment for Mpox should be considered on a case-by-case basis for children and adolescents with suspected, probable, or confirmed Mpox, especially those who are at risk for severe disease or who develop complications of Mpox. The first medication that is used, the first line for children specifically, is tecrovimab, and that is used for adults, but also is the first line of treatment for children as well. Children and adolescents who have had close contact with people with suspected, probable, or confirmed Mpox may be eligible for a post-exposure prophylaxis, or PEP, with a vaccination, immune globulin, and antiviral medication. And adolescents with certain risk factors and recent experiences that might make them more likely to have been recently exposed to Mpox can be considered for vaccination or an expanded post-exposure prophylaxis. Clinicians caring for adolescents who present with lesions or rashes consistent with Mpox, secondary to sexual transmission, should consider testing for Mpox, as well as various STIs and HIV and other appropriate care tests as possible, because there have been few cases in children as well. So today, we've talked about what it affects in both women and children. And thank you so much for joining us today. And I want to give you a few reminders as well on the various viruses that we're currently fighting as a society. When it comes to COVID-19, RSV, and flu, if you've already gotten vaccinated, congratulations. You've taken a really important step into preventing yourself, your loved ones, and your communities from illness. Multiple variants have soared across the world, and it's totally understandable why you might want to keep wearing your mask or to keep distant. No vaccine is 100% effective. More contagious variants are spreading, and there are very few protocols in place to identify or verify the status of those around you. Keep on staying alert. If you haven't been vaccinated and you're looking for an appointment, call Whitman-Walker Health. We have the vaccine available. Reach out to us at 202-207-2480 to make an appointment. And if you're having trouble making an appointment or with us, or get in contact with your local health department, and that information is available on Whitman-Walker.org, or Whitman-Walker's website at whitman-walker.org. Please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's important that you consider getting the vaccine, discuss precautionary measures with those around you, be mindful of masks, and keep your distance, but especially when you don't know the status of those around you. And again, today we have been focusing on Mpox or Monkeypox, and so you can find more information on Mpox on the Whitman-Walker website, and you can see photos and get information on what those rashes look like right on our Whitman-Walker website on our homepage. You can click for the Mpox information. There are the vaccines available. You reach out to your local health department for those vaccines. And in DC, you can pre-register for that Mpox vaccine at dchealth.dc.gov/page/monkeypox. It also has several walk-up locations to receive that Mpox vaccine. And information on those sites are also on the Whitman-Walker website. Thank you so much for joining us today. Please continue to follow us on Instagram, Facebook, Twitter, all our social media platforms at Whitman-Walker. And keep checking our website for the most up-to-date information on services. And for more COVID-19 resources and general Whitman-Walker services, please call us at 202-797-4439. That can also answer questions like Mpox as well. Follow some of our programs in Whitman-Walker Health Family outside of the Whitman-Walker page at this page, Real Talk DC, and at No Filter DC. Thank you so much for joining in today. Hope you have a wonderful day and weekend ahead. Take care.